It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Grace Sells, and welcome back to another edition of the Best Docs Network, which features some of the best doctors in the entire Dallas-Fort Worth area, Grace, that help change people's lives, like our first doctor.
That's right, Jim. And up first, we're going to see how Dr. Naila Malik was able to help Alexa with her acne problems.
The two major groups of acne population that we see in our practice are teens, which is, I would say, about 60–70% of our acne patients are in their teens. And then about 30% of our acne patients are adult onset acne. These are people in their late 20s or 30s or even 40s.
My dream was to always become a model, and just dealing with acne, it's just like it affects me mentally, and it brought me my insecurity problems. And when I first met her at an event, she told me, it's okay, you're gonna feel beautiful one day. Whatever you feel right now, it's not gonna last for a long time.
Alexa is in the group of teen acne patients. She's had acne since her early teen years, and it's continued in her early 20s now. She has been treated in the past with multiple different types of skin treatments and medications as well. Typically what happens with her and most teens is that antibiotics or any topical acne product seems to work for a few weeks or a few months and it stops working. And that's the nature of acne, unfortunately. That's the nature of this condition. After patient evaluation and figuring out what type of acne they have, the treatment is tailored to address that particular patient's needs. In her case, we may use a combination of in-office procedures, antibiotics for a short period of time, and an anti-testosterone medication to reduce her testosterone sensitivity, and that's what has led to such great results with acne control in Alexa.
I felt like an ugly duckling, like people were gonna judge me and see me like, not as pretty, because nowadays it's all about image. You wanna feel beautiful.
In my patients themselves, I see their personality change when their skin starts to improve. I mean, I've seen patients who are so shy that they avoid groups and crowds, and they're antisocial almost, and their personality completely blooms when you improve their skin and appearance.
Today now, I feel a lot more confidence, and she's done a wonderful job. I see a change, a big change now, especially from my before and after pictures. I feel like I can talk to anyone face to face. I feel accepted. I feel like a swan.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
I had a condition called true gynecomastia, and the condition is basically a hardening of tissue in the chest area. And so unlike some of the other people that have that, it was actually hard tissue, it caused pain, and it was pronounced through clothing, things like that. It was more pronounced on one side than the other. And so that kind of began the search where I looked for doctors for about 3 years.
Gynecomastia is a very common problem for many men where they have the physique in their chest that's more female or feminine, and that's why it's called gynecomastia, feminine breasts on men. And obviously most men are not happy to have breasts, and they want to have that corrected. So they like to have prominent pectoral muscles, they like to show a lot of musculature, but they don't want to have breasts.
So I talked to my primary care physician, and then I started to look at different plastic surgeons in the Houston and the Dallas area. And without even examining me, most of the doctors would tell me the procedure right off the bat, and usually that entailed to do multiple cuts around the area, multiple incisions, and then go in and from all angles kind of take out that tissue. So I knew that that wasn't something that I really wanted to do because it was going to leave a lot of scarring. So I put it off, and it ended up, like I said, it took about 3 years. And the first time I went into Dr. Azouz's office, he told me flat out, I'm going to, stay here until we answer all of your questions. And he kind of went beyond that. I mean, he came up with questions that I wasn't even thinking about. And within a few minutes, I knew he was the man for the job. I mean, he actually examined me before he made any recommendations, and then he kind of went through the whole procedure. And the procedure was going to be, 2 really small cuts, which I kind of didn't believe at first, to be honest, because I'd been told by so many other doctors that that wasn't possible, that they would have to do multiple incisions.
And what we do is we take off the breasts by making small incisions under the areola, and through liposuction and sometimes excision as well, we remove the breast tissue and we give them better contour.
Now that the procedure's done, all I have is praise and thanks for Dr. Azouz. Without him, I would have probably gone to one of the other doctors and been unhappy with the results. My life has truly changed as a result of this procedure, and I would highly recommend it to other people.
Did you know that establishing a bedtime ritual helps your body know when it is time to sleep? You can establish a bedtime ritual by doing the same things, such as brushing your teeth, reading a book, or listening to soothing music every night an hour or 2 before bedtime to relax your mind.
Bunions are an angular deformity of the big toe. It causes a prominence which then rubs on shoe wear and often becomes painful.
When you develop a bunion, it's actually this part of the bone that becomes prominent, and the metatarsal starts to move inward, and the big toe actually starts to move towards the second toe.
There are various degrees of it, and they're often hereditary in nature. Contrary to popular belief, it's not from bad shoe wear, although certain shoe wear can obviously aggravate the condition.
Conservative treatment for bunions is limited to basically wearing shoes that have a wider toe box and allow for more room and less pressure of the area.
But often it requires surgical intervention. The surgery for it can vary. There are multiple different procedures to do. Typically what we'll do is take some digital x-rays on a patient and evaluate and discuss with the patient what is the best option for them.
Which involves basically shaving down the bump and moving a portion of the bone over and realigning the toe so that it sits straight once again.
There are other conditions that can affect the big toe, such as hallux limitus. That is an arthritic condition of the big toe joint.
This is different from a bunion in that the pain is located more on top of the toe joint as opposed to on the inside of the foot.
Those symptoms are usually with walking and higher heeled shoes. It's often how it starts. You can notice it squatting.
Every day, every step, it would hurt. And so now, 5 weeks post-op, I don't have the pain that I had just from walking down the mall. I'm really glad I did it.
Following surgery for hallux limitus, the patient will begin to experience a decrease in pain within 7 to 10 days, and also an increase in range of motion at that big toe joint.
She actually told me that if I did not have it done, I'd end up with a fusion or a joint replacement. And a fusion means that you will never wear a high heel. It's like your toe is like straight, there's no bending it. That didn't seem like a good option. And who wants a joint replacement? I want my own joint.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
Sarah has a question for Dr. Michael L. Thornton. What is a Brazilian butt lift?
A Brazilian butt lift is basically a 2-in-1 procedure. It's a procedure where you're performing a lot of liposuction to contour the waistline, okay? And once you take all that fat out during the liposuction procedure, then you put it back in the patient's butt. So it's called a Brazilian butt lift. And what it does is it gives them a nice waist to hip ratio. Okay, you want to get a small waist with a nice round bottom, and you put the fat back inside their butt. Instead of throwing away the fat, you're actually harvesting the fat to put it back into their butt and sculpt it so it looks really nice. And there's a few tricks. It's a very artistic procedure. It's not something for everybody. You have to know what you're doing so you can make it look good, because not everybody can make a butt look good.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
It's important to first determine that if they're an appropriate candidate for a facelift or not. The general principle is you have to have enough looseness of skin and redundant skin to be a good candidate for facelift. If you don't have enough looseness of skin or laxity, it just won't work very well. You have to preserve the central third of the face, so this oval, if you will, because that's really what defines us as uniquely individual.
I am getting older, and teaching is my third career. And what I observed was the older looking teachers were losing their jobs. And I just wanted to look as young as I could. I had tried a variety of other things, other procedures, and I finally decided to just go for it and go to Dr. Ducic and get everything fixed up. I was impressed by his place of business, as well as his people were all very friendly and helpful, and they just made me feel comfortable. It was overall a positive experience, and I felt like he really knew what he was doing.
We have so many minimally invasive techniques available today that really have very little downtime, have excellent results, and make you look more youthful and fresher, because that's the whole point of everything. It's the point to look better. And however we can accomplish that, that's easiest on the patient, that's what we want to do.
I don't think he does things that don't need to be done. So he doesn't push more than you would need, whether that be shots or surgery or whatever. He does what he thinks is going to give you the best result. I definitely am glad I had this done. Most people have no idea how old I am, so I feel pretty good about that. Nobody's tried to fire me for being too old to teach, so I feel pretty good about that. And I'm very happy with the results, very happy.
Sunscreen is unlikely to stop you from being sunburned or reduce your risk of skin cancer if it is not applied properly. Most people do not apply it correctly and stay out in the sun too long. Be sure to put plenty on and reapply often.
For years, I've been very self-conscious about my smile. I took some antibiotics as a teenager, and that permanently discolored my teeth. I tried bleaching professionally, I had tried in-home bleaching, tried buying stuff off the internet, everything I could think of, and nothing was working.
On her, we did the crown lengthening and gingivectomies to take the gum up, and then we did veneers across her upper and lower teeth, and then in the back we did crowns because they were kind of broken down and needed restorations. And we opened up her bite, and so it gives her a more youthful look. The whiteness of her teeth, made her look great. It was just fabulous what it did for her.
Before I had my smile makeover, it affected even how I took pictures. Just in a social setting, somebody's snapping candid shots, and I would rarely would open my mouth to smile. Once I had the smile makeover, I'm just flashing the pearlies.
What I love about what I do is that it changes people's lives. It sounds kind of corny, maybe a little melodramatic, but people who have had a smile that they aren't happy with and that have been conscious of it their whole life and try to hide it, then you take that away and make it to where they can smile and they feel confident about their smile, and confident about how their teeth look, it changes their life.
I think it was October when I had the final visit. That Christmas, I went to my brother's, and my mother was across the room from me. My mother's 82 years old, and she looked at me and she said, "Your smile is dazzling." And I was like, "Well, thank you." Before I came to see Dr. Lewis for my smile makeover, I was always self-conscious, a little fearful about trying new things or stepping out of my comfort zone. And after I feel like I can take on the world, I would just say that if anybody's considering a smile makeover with Dr. Lewis, they should go for it. Get your consultation, get in, you'll be happy.
For more information and to check out hundreds of videos on the amazing doctors you see on our show today, head to our website. It's bestdocsnetwork.com.
That is the place to go, and the place to go right now, Grace, is our next best doctor. It's orthopedic surgeon Dr. Charles Tolson, and he helped Brenda, believe it or not, get her groove back with a double hip replacement.
I had gone from such an active lifestyle to a life of where sitting, standing, sleeping, trying to turn, trying to walk, getting up off the sofa was a major ordeal for me. Any kind of movement or non-movement was excruciating.
Brenda is in her 60s. She came to me because she had severe arthritis in both of her hips. She had seen other doctors. One doctor prescribed injections, but they only lasted a few days. So we found that she was indicated for bilateral hip replacement because she had severe arthritis in both hips.
After an examination, he goes, "I have good news and I have bad news." And he says, "Well, the bad news is both of your hips are in really bad shape." He says, "You're going to have the bilateral hip replacement. The good news is I can do it, and I'm happy to do it." Dr. Tolson also had a model of the hip, and he said, this is what the procedure's going to look like. And he talked through the whole thing, and he says, "You're going to be a new person once you have these hips in."
It takes about 6 to 8 weeks for a patient to recover from hip replacement. But when you do both at the same time, it literally takes about the same amount of time for them to recover. This in particular makes bilateral hip replacement an ideal surgery when you have the perfect candidate. Because Brenda was very healthy, we were able to accomplish both hip replacements in one setting.
After surgery, I woke up and I cannot begin to tell you how wonderful it was. I was without the pain that I'd had over 2 years.
Brenda is doing amazingly well. She is just so happy and happy with life. She walks 3 to 4 miles a day. She has no pain. She's able to do everything she wants to do in her life, and we're extremely happy with her outcome.
I just cannot thank Dr. Tolson enough for giving me back my life. It's truly a gift, and I will be forever grateful.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
We've all had nosebleeds. Now, most nosebleeds are both sides, and that's okay. A nosebleed that happens only on one side and always on that side can be a signal of something up in that nostril that's not good. For example, a sore that won't heal, a benign polyp, or even a little tumor. Rare, but it can happen. Now, most nosebleeds occur in the septum. That's the middle part of your nose on the inside, not the outside. That's where the blood vessels are clustered up right below the surface of the mucous membranes. And usually that will be just oozing blood, not pumping blood. Pumping arterial blood is a bad sign. Now, if you get a nosebleed, you should do several things to stop it. Number one, put an ice pack on the back of your neck. That's where the blood vessels originate from the back of the neck into your nose. So that will shrink them down back there so you'll bleed less up here. Also, putting petroleum jelly or some sort of moisturizing first aid ointment on the septum, the middle part of your nose, will help soothe those irritated mucous membranes and stop the bleeding. Pinching your nose and putting your head back also helps, and making sure your blood pressure doesn't go up. That also helps reduce a nosebleed.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
Welcome to the Best Docs Network. In the studio, we're very pleased to be joined today by one of the top LASIK surgeons, not only in the Dallas-Fort Worth area, but in the country, Dr. Harvey Carter. Dr. Carter, thanks for being with us today.
Thanks for having me.
It's a pleasure. And now talk to us about how you started in this field.
I chose this field of medicine because I loved microsurgery, and I found that out very early in medical school. And ophthalmology is an incredible mix of microsurgery, laser surgery, and wonderful, wonderful technology.
And you did your undergrad at SMU. Did you always plan to come back to Dallas to start your practice?
Yes, that was my goal. I came to SMU because of the pre-med program back in the time that we went here, and then went to LSU Medical School in New Orleans. Then did my internship back here in Dallas and residency in Georgia, and then back here to Dallas again. So I love Dallas.
That's great. And you have a lot of ties to the community, very involved in the Dallas community. You're the official LASIK eye surgeon of the Dallas Cowboys. That has to be both exciting and very rewarding.
That's been an incredible, incredible journey, and I sort of fell into that.
Really?
Went to a charity event many, many years ago. And while we were there were a number of Dallas Cowboy players there. And one thing led to another. And first, Tony Casillas' wife came in and had LASIK surgery. And then Tony Casillas came in and had LASIK surgery. And then I think it's like 50 or 60 Cowboys over time came in and had LASIK surgery.
That's so fun. And what would you say sets your practice, Carter Eye Center, apart from other eye practices in the Dallas-Fort Worth area?
I really think it's personal service and high technology. Patients, I think, are looking for personal service, and at the same time, I think they're looking for high technology. They want the latest, greatest, they want the best.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures, as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
For more information on any of our outstanding doctors, head to the website, bestdocsnetwork.com. That is bestdocsnetwork.com. Now to our next best doctor. It is cosmetic surgeon Dr. Michael Thornton, who helped Taya get her figure back with a mommy makeover.
I'm a yoga instructor and fitness instructor, and I had 3 babies. And after having all 3 babies, I started to realize that no matter how hard I worked, no matter how much weight I lost or how much muscle mass I put back on, I wasn't seeing some of the changes that I wanted to see.
When women have children, their muscles in their abdomen separate, and they sometimes don't come back. And so what happens is that's how they get the little pooch in the lower abdomen region, and it stays there for life.
Before I met Dr. Thornton, I didn't know what I was going to need to have done in order to feel like myself again.
She had a very interesting problem with her abdomen, meaning that she didn't have a lot of skin to remove, but she had a huge separation of her muscles.
He convinced me and explained to me the things that I needed to do, and that no matter how much fitness I did, I wasn't going to see the changes that I wanted to just because of, having 3 babies and what it does to your body.
I came up with a plan with her. It's called an umbilical float. You can't force that procedure on everyone, and you have to pick that person exactly. And Taya was the perfect person, so she had a mommy makeover. With her, I did the minimally invasive tummy tuck, where I just make a small incision in the bottom, and I release the belly button, and it allows it to float upward. And then I go all the way up to the almost near the breastbone, and I sew up her muscles all the way from the breastbone all the way down to her pubic bone. And that literally brings her abdomen back into its normal alignment, so it gets real tight. And then I just stitch her belly button exactly back down where it was before, and then I pull out the excess skin. Well, good candidates in particular for mommy makeovers are just women who are between the ages of 35 and 45. That's kind of our average that have grown kids and now they want their body back. Usually it's some sort of breast revision surgery in combination with abdominal revision surgery. So when you're done, they have improved breast and they have improved abdomen. And that's really what the mommy makeover is.
I am so glad that I went with Dr. Thornton. I'm so glad that I had this procedure done because I feel like myself again. I now feel like I look how I feel. It was probably the best decision I ever made.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Drink green tea. It's packed with heart-boosting and cancer-stopping polyphenols that black tea doesn't offer. Green tea also delivers a boost of alertness, but from a smaller dose of caffeine than black tea.
Initially, we had a lot of trouble getting patients that were from outlying areas taken care of as far as their adjustments for their bands.
When you adjust a lap band, what you're doing is you're accessing the port, which is located in your abdomen area, and you put saline in it and it blows it up just like you would an inner tube. As the food goes into the stomach, in that, which we call the pouch, it has receptors. And with those receptors is what triggers to the brain that you're full. And by the lap band restricting and holding that food in that area, you will get a full feeling much quicker than what you would normally.
We had a fluoro machine because we do all of our adjustments with an x-ray machine, and those were extremely expensive, and I had to figure out a way to get those to the patients. At that point, we decided to put that in a mobile unit, or we call it a lap band wagon, to do adjustments for patients on site or at least in their area.
This is where we do the actual follow-up appointments and also do the fluoroscopy on the patients to make sure that their band is working and to see how much their band may need to be adjusted.
The fluoroscopy machine is like a live video. They drink barium. It allows us to actually visualize it going down the esophagus, in through the lap band and into the stomach. This gives us an idea of how everything is working inside.
It's just as sanitary, just as sterile. We use the same procedures as if we were in the emergency room or in the office.
Because follow-ups are so important to our patients' success, we've made it possible now for all patients, regardless of the type of procedure that they've had, to be able to do their follow-ups on board the lap band wagon, which makes it beneficial for the ones in Abilene, Amarillo, Waco, the different locations that we drive to. But we are the only practice in the country that has a mobile unit, and we're really proud to have this.
That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And for more information on any of these great doctors, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
And if you have a question, a comment, or a life-changing story, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.